Welcome to The Holistic Nurse with your host, Peggy Smith. Peggy will introduce and educate her viewers about the differences between alternative, holistic, and complementary medical therapies. Her goal is to empower the lay medical consumer to learn how to advocate for themselves. So now, please welcome the host of The Holistic Nurse, Peggy Smith.
Hello, welcome back to The Holistic Nurse with Peggy Smith. Today we're going to be looking into a topic that many of us are a little bit afraid to delve into, and we don't quite understand it. I'll try to simplify it. We're going to be talking about AI technology and patient care and how it affects insurance outcomes. And Dr. Gloria Warren will be joining us today also to give her professional. Good morning, Gloria. How are you?
Morning. I'm well. Thank you.
So, um, and if you're wondering why AI and how that's holistic, I view holistic, as I've said before, all aspects of our lives, our health, holistic is everything. If we can't manage our finances and our nutrition and things like that, uh, you're not going to be successful managing everything in your life. But AI technology is a little bit scary for people sometimes. And, we wonder if you hear things about AI is going to be making the diagnoses. AI is, they've got AI therapists now, all kinds of things. And one of your common questions is AI really helping us or hurting us as patients and medical consumers? And the answer actually is both. It could be both. AI has the potential to improve accuracy, speed, and access to care. At the same time, we always worry about privacy, but honestly, they're not doing a good job about maintaining our privacy these days anyway. Maybe AI can help improve that, but bias and over reliance on technology. And just like any tool, its impact is going to depend how it's used, the ethics that are behind the development of the programs. But the subject came to me because recently I was reviewing a patient's records that had been at several hospitals over the last 12 months, like 350 pages worth of those EOBs that you get in the mail from your insurance company. EOB is explanation of benefits. And it's very overwhelming. You couldn't begin to figure out. It looked like you were being double charged and not being charged, and it looks like the secondary insurance was charging you more than they should. And what I did, I asked AI, can you summarize all of this for me? And in 5 minutes, he took a year and a half. I don't know if it's he or she, but it took a year and a half worth of medical records from 4 different hospitals and medical facilities with all of the results, the medications. It noticed duplicate medications, medications that were missing at different parts of the file, like here today, gone tomorrow when you change to a different facility. And it brought out those questions for me. Also found many financial mistakes where insurance was saying, Medicare says you shouldn't have to pay more than, say, $20, but the secondary provider or maybe even a third party provider who is not in your network, but you didn't know that because he was part of the hospital system that is in your network, wanted to send you a couple $100 bill, and Medicare was basically saying he's got to accept you're a Medicare patient. You shouldn't have to pay more than X dollars. Uh, so it can be very helpful. Gloria, what has been your experience? It's an ever changing new topic for everybody.
Well, actually, I'm a certified AI engineer,
Well,
so
that helps.
that helps. Yeah.
You're also
But
a full-time caregiver of somebody who has a
oh,
lot of medical bills, and
that's
going
true.
through
That's
that.
true. I love that you fed it into AI. I mean, there are so many different purposes for AI. Medically, though, they just the research that was completed last week and reported on this week was that with the medical terminology and the medical situations, whether it's the doctor doing it or just somebody at home, hey, these are my symptoms, this is what I'm feeling, and this is, this result. And they found an 82% accuracy, but that leaves an 18% inaccuracy with medical findings. So, just make sure to, if you're going to do something like that, you can do it as a first step, but then you really need to double check with your medical provider because they have more information whether or not they'll catch some of those mistakes. AI is not perfect. It takes time for us to build a system that is perfect, and that's probably never going to be perfect. So that we're using it in different places, but AI refers to computer systems that can analyze data. So it's only as good as the data that was entered into it. So
Well,
that's where the
my
problems
personal
come in.
experience, a couple years ago, I saw a neurology specialist, and he's looking in his computer, and he says,
Hmm.
"When did you stop taking X drug?" And I said, "Well, it wasn't in his field. Well, how did he know?" And then I realized, oh, the everything we buy at the pharmacy is in this, in some of the
Mm-hmm.
preliminary AI things. So any
Mm-hmm.
doctor should know at a glance what you're taking, so he doesn't prescribe things that are contradicted with it, or would not be good for you. He's more aware sometimes of your allergies if you have some rare allergies. uh, for instance, when I had surgery a few years ago, all of a sudden I have 30 allergies in my profile that I'd never heard about, and they explained, well, you had a problem in anesthesia and we don't know which ones, so we listed them all, so we know we'll be careful next time. I don't know if that.
Wow.
There's a lot of times too, maybe you have a new symptom and you get the nerve and you make the appointment for the specialist and you're so worried about that, you're not remembering simple things in your history or even early signs of whatever the problem is that
Hmm.
brought you to the doctor. And AI, literally in 5 minutes, it gave me a spreadsheet that included all medications, all hospitalizations, all providers that were involved in the last 18 months, and a summary of the bills. And you might want to double check. It said, on this date you would charge this, but it looks like they shouldn't have charged you, or they charged you, you paid for it already. And they found duplicate things like that. But we're so overwhelmed, especially if we were worried about having a serious medical condition, that we're really not going to remember. um,
Hmm.
it's a good idea for all of us to have, whether it's on your phone or in your files or somewhere, that on your refrigerator. Even some of my home care patients keep their medical history on the refrigerator for the paramedics
Yeah.
should they emergency. Because if you're unconscious, something happens to you out, at a restaurant or something like that, you're not going to be able to tell them. And they know how to crack your iPhone. I guess soon the same with Samsung's, to get to your medical emergency file, but not all of us put that information in. It is safe to keep it in your phone like that. It's also a good idea, if once you have AI collect all this, when you see your primary provider, maybe say, hey, you have all the same information here. Um, so I'm one of those people that was a little bit leery. I didn't, Big Brother
Hmm.
sometimes it is in our house too much. I mean, when you're
Yeah.
talking to a friend about where should we go out to eat, and then Siri or Alexa makes a suggestion, it's like, Siri, I wasn't talking to you, but thank you. you know. Um,
Yeah.
so those kind of things make us more leery. So what are some of
Hmm.
the examples that you found, since you've done some scientific research on this? Do you feel like it's safe? And if anything stands out that it's really can be helpful?
Well, my son is 1 in 5 in the world for IT security. And as he would tell me, nothing is completely safe. So that's where questions come in. It takes this data, recognizes patterns, learns from this information, and assists with decision-making process. And many places are using it: hospitals, clinics, medical imaging departments, pharmacy systems, like you had mentioned, electronic health records, which may be good if they may not know some of it, because if you're not feeling well, you don't remember everything. And of course, like you had mentioned, insurance claims for processing claims. There is a place in society, no matter how secure it is or not. But if you really want to know, e- every system, just about every industry has been breached at some point or another. So don't ignore those letters that come in the mail. And also realize, though, and know that things with your medical records, if there's something incorrect on there, you cannot have it removed unless you can support it legally and medically through other physicians and maybe even an attorney. A hospital will not remove that from your file. I found this out because I myself has something on there. I'm like, what is this? That's not my result. And I went and I talked to them, and I actually had to go somewhere else to see a different doctor to prove that that's not anything to do with me. You know, it's only as smart as the person entering it.
I was
So
going to say,
yeah,
yeah.
back to that. Everything is human. And even though this is a data system, it's a data warehousing type system, it's only as smart as the people that made up the data or entered the data. So you have a little quality control to deal with there, and you may have it later on too, because you need to ask, what are you doing with my data? Who gets my data? You know, where does this go? Who has access to it? You know, these are important questions, and you have the right to know too. And if you don't know, you dig deeper. Okay?
Well, I remember taking my husband to his primary doctor when they were first making the doctors do the electronic medical record. And this was an elderly doctor. He had his iPad. The entire visit, he didn't even look at my husband once because he was so afraid of making a mistake typing on the iPad. And
Yeah,
I felt a little bit cheated there, you know. And then as I've worked with insurance companies and, you know, work with people with specialized medical problems, and sometimes no matter how much you need the medicine, you've got to go through hoops to get it approved by your insurance company. And
hmm,
AI has created certain algorithms to determine whether or not you qualify or if you should be they don't usually care if you should be an exception. That takes extra homework. But I think we did a show in the recent past, I don't remember, to talk about if you get denied ever by your insurance company, they're betting that most people will not even read their statements, let alone, you know, fight them.
yeah,
But they actually bet that 90% of the people do not appeal, and they save money because of that. I've had home care patients say, well, I guess I'm just going to die sooner, you know, if I can't have this necessary treatment. And I'm like, no, you can appeal. And the majority of the people that appeal, if you know, if your doctor supports the documentation, you will win the appeal and you can get the treatment you need.
yeah.
Uh,
You
and
can't involve an attorney with any of your medical care. So
you said
just
you
letting
can,
you, you can, yes, especially if you're on public aid or Medicare, and you feel that if you feel that you're not getting, they're not doing anything, they're doing what they call comfort care, and they're not treating anything, then you can actually get an attorney involved, and they will notify them that you need further care, and you know, according to the medical guidelines, and then they will actually step up their care. But you know, it's a lot to do with whatever, you know.
where we keep politics out of this. But
Yeah,
it's
yeah,
also important, though, that you have your living will and your power of attorney. You
right.
set up young as first time you're a parent, you should have a will. I remember when I had my first baby, the MetLife insurance guy, he must have had the list from the hospital. He's knocking on our door that week. Can I sell you life insurance for your little baby? You know, and we couldn't even afford formula, you know. But
Yeah.
but it's true though. You do have to look at the future because
Hmm.
tomorrow's not promised. And but and nothing is perfect, and we don't know why the higher powers, you know, some people make it, some children make it, and some don't. It's challenging for everybody, but it's you being an ostrich, burying your head in the sand, and just hoping you won't be one of the ones that get
Yeah.
screwed. You know, use common
Right.
term. You have to. It's your responsibility to be on top of this, and we're going to just try to help you understand how we can do that. I'll give you a little more information, and we will be right back after the break and go into some more examples for you.
What if there were a super tiny device that could diagnose the brain and is smaller than a single human hair? What if you could see inside the brain to help an epilepsy patient during surgery or to help the fight against Parkinson's disease? Dr. Patricia Broderick is proud to announce the Broderick Probe, a biomedical and electronic breakthrough. Imagine a probe to help with the understanding and potential cure of brain-related diseases. To learn more, listen live to the Easy Sense radio show with host Dr. Broderick. And to help support the Broderick Foundation, please go to EasySense.com and learn how, with your help, we can fight these horrific brain disorders. That's EasySense.com to learn more and help support the Broderick Foundation. Author, radio show host, and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness: Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them, rediscover and assess their core values, philosophies, and competencies, find settings that allow them to be the most productive, and track their progress towards accomplishing goals.
Hi, welcome back to the Holistic Nurse. I'm Peggy Smith. This is with Dr. Gloria Warren, and we're trying to simplify the benefits of artificial intelligence in healthcare. Uh, Gloria, so go a little bit to where, why it can be helpful and where we're already using it. Maybe we didn't even realize it.
I think, yes, we went a little bit over some of the negative things to be aware of, but there's so many positive things here that you can benefit from. Early detection is an excellent thing, obviously. If you know beforehand, hey, this is following the pattern to that disease or this situation or these problems. And that's where AI comes in. It really helps finding those early cancer indicators and what your heart disease risk is and stroke patterns, medication interactions. That's another one. That's something I find with patients very often if they're not using AI, if their medical community is not using AI. So consider that. But then there's also things on a daily or weekly or yearly basis. Imaging. AI can analyze medical images, not just a doctor, but AI can analyze it and point out things that maybe the doctor would miss to help
Well, I
identify
know in our
patterns.
part of the country, we actually have a shortage of radiologists to read those
Yeah.
images, and sometimes people
hmm
have an excessive amount of time to get the professional opinion. So that would be very helpful.
Right. It could support early detection of disease. So lab work, AI can review the lab work too, the results, and highlight trends or values over time that may require further attention. Risk factors, that's another one. It can evaluate multiple risk factors simultaneously, where a physician, they can do one at a time and sometimes cross over, but simultaneously to help predict potential health concerns and support preventative care strategies. So potentially identifying disease sooner, in short.
Well, every minute counts in those situations, especially I work with a lot of children,
hmm
and you want to get them, especially. Well, we all want to find it as soon as we can, but I have older
Yeah.
people sometimes that say, "Well, I got to die of something," and you don't have to die sooner of something. Um,
Right, right.
so this really amounts, I think, to a higher quality of life. And sometimes I've joked about how it feels like doctors aren't much better than car mechanics before the cars were all computerized. AI has been in the mechanic business and the
Similar.
car, it's like, oh, I think it's your carburetor. No, we changed that. Well, let's try over here.
Yeah.
And, and I feel like sometimes the doctors in the old days, they were going on instinct and gut and experience. Um, but as people are more worldly, they travel outside of their, locale. There's things that you can pick up, things that, the type of work you're doing, your profession. You may be exposed to things that we didn't realize until we saw a pattern of, coal miners having black lung disease and, things like that. So AI really can even assess ways in your job, maybe to make you less at risk. If somebody's got to do these jobs, and uh, I agree with you. I think it is very positive, but I do understand, especially we hear about how it's eliminating jobs. But it's kind of like your family mechanic. He grew up with his dad teaching him how to do the car and things like that. And now he's got all these new computerized cars. He doesn't get computers and devices to test out the computers in the cars, and most of the time it's your computer, not the car that's broken. Um,
Yep.
you got to keep up with the education, and you have to keep up with your own health. AI, even if you're somebody that takes a lot of vitamins and holistic products, they can, and you're honest with that, you tell them everything, they will actually tell you, point out the
Hmm.
contradictions, why what herbal things actually could be dangerous with the medications that you're on. And that doesn't mean stop those medications because you want to do everything holistic. It means talk to your provider and make sure everybody's on the same page. And uh, you know, you get better medical care if we're working as a team together.
Yeah, absolutely. When you're talking medication, there are herbal blood thinners. So you could be on a blood thinner, pharmaceutical blood thinner, and they can cross over pharmaceuticals and herbals. Because if you're taking excessive garlic or ginger, those are also blood thinners, as well as turmeric and ginkgo, a dong quai, which I love dong quai. And there's a whole list of things that are blood thinners. But then if you're on blood thinners or on EDTA or something of that nature, you could be getting way too many blood thinners. AI can cross that boundary, but it won't cross it if somebody doesn't feed it in to get those
Right.
answers. So,
And I know, usually before surgery, the doctors commonly will say, well, stop your fish oil and vitamin E rather, before surgery. But some of the others you just mentioned, doctors, many of
they
them might
don't
not even
know.
know mentioned. And,
Right. Right. Um, that's what I
so,
always have people asking me things about because I'm also a licensed herbologist. So I'm crazy. I do everything. But yeah, it's one of the areas that I find I actually identify many errors in those situations, as well as pharmaceutical errors. And I'm getting less and less of those. Maybe it's because they are using AI. And I'm grateful to that because it can help them. I'm here for questions if they ever need, of course. So,
so when they're, with risk prediction and all that, we're
hmm.
getting prediction through our genetic social sites now. And, um, people just feel overwhelmed sometimes. Everybody's trying to help, and sometimes there's too many cooks in the kitchen, it feels like. Um,
Yeah.
you know, what can the average person do who doesn't have a medical education, uh, and to really know that they can trust what they're hearing from the doctors and know
Hmm.
um, that they're on the right track for the healthiest life. Most people wanna have a healthy life and live as long as they can.
Well, actually, what I would suggest is just to see what it says. It doesn't mean it's going to be gold, set in gold AI, but you can go online. Most organizations now have online health records, and you can go and do a control A, and it'll highlight everything in there, and then you could do a control C for copy, and then you can take that whole thing, put it into a Microsoft Word document, and upload it into AI and ask them, what is my risk predictions here? What do you analyze for my disease situation and outcomes and timelines and things like that? You can ask it any question you want, and it actually will tell you some things. You're like, oh, that's interesting. Now, of course, if you tells you something medically that does not make sense to you, of course, please, ask your health provider.
Well, some of the controlled keys that you were talking about, what I did in the case of, this patient, where I was first experimenting with this, is I literally just took my phone and snapped a picture and then copy pasted all the pictures,
Yep.
which gave a 350 pages, and I did not
Wow.
expect what I got. I was very pleased.
Yeah.
But, I got a spreadsheet, I got questions to ask the doctor, had, saved some money on bills that we don't have to pay, duplicate billing, things like that.
Hmm.
But, and most of us and myself in the past, when I got, this is not a bill in the mail, I didn't even save it. Good, it's not a bill, I don't have to worry about it. File 13.
Right.
But there's so many mistakes that are made in billing, partly because of AI, but partly because maybe the human provider inputted it wrong or a secretary. You really and it's nobody's responsibility but yours in the end. But you get options. They'll suggest, well, maybe ask your doctor this, or maybe you should seek out this type of specialist who knows more about this, um, AI's even suggested diets. Well, it looks like with these lab results, you might want to try lowering the salt in your diet and less fat. And I know you're not a diabetic, the thing will say, and say, well, but he's evaluating everything he sees and, didn't see any evidence, but your eating patterns, your weight patterns, and all that, they took into effect. And I'm still kind of in awe, but and it saved a lot of time. I was dreading going through 350 pages and,
That's a lot. So,
uh,
but I like too that you said that, you can reduce that financial stress, by better understanding the costs and insurance benefits, treatment options, like you said, and maybe the uncertainty behind all the billing information that you keep getting in the mail or getting emails. And I love that you did that.
uh, so,
It's
well,
very,
I found too in the past, like it's human to, I don't want to use the word freak out, but have a lot of anxiety, just about potential. In my ex-husband's family, when we were younger, there was no male that lived past the age of 50. I never really understood why. There was even an uncle who, perfectly healthy, stepped off the back step, broke his neck at 50, and died. Uh, my ex is still here and, well into his 70s.
yeah.
So just because, the family history, the rumors you hear, and, hopefully we have better quality foods and, we're hydrating better, we're going to doctors more often. But we're beginning to see a trend that it's harder to get to the doctors. So you want to maximize the time that you are with the doctor,
Mhm.
because he's only allowed by insurance companies, unfortunately, to spend so much time with you, and they get paid less money if they spend more time.
Yeah,
Um,
I was a little surprised to hear that when you mentioned that to me,
yeah.
because I always forget that point, because I always think that a doctor should spend a minimum of 10 minutes, maybe 15 minutes with a patient. I remember though back in the day, uh, when I was working with doctors when I was younger, they would take 5 minutes a patient, one, and we would line them up for them. And they actually were so comprehensive with them. It was amazing, just amazing how they did that. But they had a system in place and that system's been thrown out the window. But a lot of it too is because of the insurance companies, like you're saying. How does that work again?
Uh, well, I mean, the insurance companies are dictating. I remember one of my kids needed some special blood tests. That insurance company said we couldn't have it more than once a year, but the pediatrician wanted to do it to keep a closer eye. Um, the
Hmm.
the prostate screening test is one that insurance only covers once a year, unless you've got specific documentation why you need it more often. Um, so one side doesn't fit all the rules. We're all like
Yeah.
square pegs trying to be hammered into round holes. And I think uh, as long as you're aware of what AI is sharing, and what the doctors are inputting, you just don't you can't rely on the doctors totally. They're human.
Hmm.
And they're basing it not just on AI, but a lot of it on what you're sharing with them. So, like I talked to a lady complaining after the doctor visit that she had a lot of pain. The doctor gave her nothing for pain. And I said, well, did you tell the doctor you were having pain? She looked at me like I was crazy. He should have read her mind. But we're coming up on another break. We'll be right back.
Did you know that your beliefs create your entire reality, but it's the subconscious beliefs that do most of the creating? Belief shifter and life coach Shiraz can help you identify those limiting beliefs and eliminate them, often in a single session.
Like it was almost instant. Like I had relief right away.
Creating better health, relationships, careers, and finances. Let Shiraz help you step out of safety and into awareness.
Definitely something's happening. It's like a flow inside. It feels good.
Whether in person or online, Shiraz provides personal coaching, belief shifting. Visit Shiraz at energeticmagic.com or call 416-529-7429. Energetic Magic. Find your greater happiness. Be well. Be aware. Be magical.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent, but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of the Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on the Caring Generation and PamelaDWilson.com.
Hi, welcome back to the Holistic Nurse with Peggy Smith and Dr. Gloria Warren. We're kind of talking about AI and how it's going to help us, how we can alleviate our fears, how we can be part of it as it's growing forward and contribute to its growth in a healthy way. Gloria, you feel like this is the right direction for our future, or are we just forced to it
Um,
because less
I
doctors?
do. I do. I mean, I think they need to still strengthen IT security, which they are actually. It's slowly being intertwined into different systems, the real good IT security. So I think they should, because another thing it does is it helps. It's a tool, but it helps with rural communities by improving access to healthcare services, specialist consultants, and early disease detection. It also really helps the underserved populations and support underserved populations by helping identify healthcare needs and expanding access to preventative and personalized care. Telehealth programs is another area. AI tools can enhance telehealth programs by improving virtual assessments. That is like leaps and bounds that made, because you can see a doctor online on your computer. You can talk to them, and it's great for patient monitoring too after procedures or just even some basic checkups, communication with patients and healthcare providers. I really
Well,
think that.
Telehealth really expanded during the COVID era because people didn't want to contaminate everybody, and they
Mhm.
needed access to healthcare. And like if you needed a second opinion and you're, say in Philadelphia and you wanted to go to the Mayo Clinic or somewhere else, what's in MD Anderson in Texas and things, you couldn't afford, or you might have been not physically well enough to go to travel. But telehealth and getting second opinions through AI and electronic digital transmission has really opened up opportunities for patients to get the best treatment.
Yeah.
Uh, And if you're getting a consult, in the case of a cancer patient, at one of these other places, thousands of miles from where you live, those thousands of mile facilities actually work with your local hospitals and doctors and say, this is what the treatment plan we would recommend. And usually your local hospitals are, more than happy to, include them in the whole picture.
Yeah.
And that's, really helped to extend lives and and build a better quality of life. You don't feel like, I can't afford to go to Mexico, so I'm stuck with what I have, and maybe it's, going to be a short battle. You
You've
always
been
have
reading my medical report. I go down to Mexico a lot for anything. Anyways, what about
uh,
insurance though? I mean, isn't it good for other areas of insurance?
what are you asking there on the?
Like, processing claims and fraud detection, things of that nature.
Well,
Um,
absolutely, and people don't realize with the umbrella of identity theft, because many people don't have insurance, and or have limited means, and they haven't maybe been able to
mhm.
keep up computer wise with things, um, that part of identity theft, one of the biggest areas is people steal your identity so that they can get medical care. And then all of a sudden you find in your records somebody
Yep.
else's medical problems and your insurance paid for it. And it wasn't even you there. And
Yep.
if it's in your history, that's why it's important that your insurance profile is accurate. You get rated higher for the cost of your insurance.
Yeah.
Uh, I remember when we had the couple presidents ago with the new insurance programs where everybody would qualify for insurance. And you go to the website and it was saying, oh, look, I only have to pay $200 a month. So I'm calling the insurance agent and saying, this is what I want. I was living in South Carolina at the time. And I said, "But that's not the price quoted on your website." And she said, "Well, honey," she said, "by law, we have to give you insurance, but we can charge you more if you have pre-existing conditions. We just can't deny you because of pre-existing conditions."
Mm.
So, and that's a reality. And, I think they're a little bit better about things with that now, but it's another example of, and they didn't even know that I had had cancer in the past. So obviously I didn't share that information with the insurance company. It was like, oh, okay, now I understand. And it's really important. Sometimes the doctors, if you're in the hospital, might upgrade your diagnosis. Maybe you just have asthma, but they might put the
Mhm.
label ERG code of COPD, chronic obstructive pulmonary disease, because they get more money with a higher diagnosis.
Mhm.
That can backfire from your
Wait,
perspective.
wait. Say that again. They get more money with a higher diagnosis.
You get higher insurance reimbursement if you just have
Mm.
asthma, which is childhood disease and, blah, blah,
Yeah.
and you happen to be hospitalized because you have pneumonia as a result of your asthma and the cold weather or whatever. You might
Right.
find COPD on your medical history now, and nobody
Mm.
ever told you that you have COPD. You're not even going to a pulmonologist, unless you met them in the hospital. So you just can't. And the type of things to pay attention to. I was in the ER. Turned out it was going to be kidney stones. With later doctors, another ER. I found out, but I
Mhm.
spent a few hours in the ER. With my neighbors bringing me home, 2 o'clock in the morning. I get a text message that there's a bill waiting for me, and I thought, oh, this is good. I got to see this bill. I'm literally
Mm.
10 minutes from the hospital, and it's 2 o'clock in the morning. So that was AI. They were charging me for a $20 pregnancy test. Me at, like,
Okay.
67 years old. They had done abdominal X-rays. They knew that I don't have those organs anymore due to past medical history. It said very clearly, "There are no female organs in this X-ray." But the hospital did a pregnancy test, the $20 kind, and charged $200. My insurance was charging $200, was charged $200 for that test.
Right.
And, I as sick as I was feeling that night, first thing I did in the morning was call and, get that off, and I refused, told the insurance company not to pay.
Right.
Um, Years ago, I had a child getting adolescent psychiatric care, a male child. He got a pregnancy test in the bill, and it was a rare time that I happened to look at the bill, maybe because I wasn't used to my kids being in the hospital. But I called the lady. I said, my son was just in the adolescent unit and you're charging me for a pregnancy test. She says, yes, ma'am. Everybody gets a pregnancy test in the adolescent unit. I said, this is my son. He's 13. And she said, yes, ma'am. Everybody in the adolescent unit gets a pregnancy test. So I finally said, well, have you ever had a positive male pregnancy test? Oh, your son, she says. Now that was policy, but somebody messed up there.
No.
And
No.
so it's
Yeah.
another example, though, why you can't rely on what the computer spits out as being currently accurate.
Right.
Um, and I didn't know what I knew about insurance. I started paying attention a little bit better,
Right.
to bills at that point. Uh,
With insurance too, they analyze the risk. Because I'm an epidemiologist, it's very important to me to know the demographics of where somebody lives and things of that nature and what's around them, because they use AI to figure out what your risk factor is for health evaluations and your long-term outcomes and things. So they look at your past health, they look at the demographics, the historical data, and that's when they make the decision, how much are we going to charge this patient, for insurance purposes, So
Well,
it's another
now
area too that,
the patient, the devil's advocate here, that doesn't seem very fair. I mean,
no, but they're
I've had
doing it.
I've had cancer patients being told they have 2 weeks to live. Get your affairs in order.
Hmm.
2, 4, 10 years later, they're still alive. So,
Right.
nobody has a crystal ball. Um, it's important that, you remember that, yes, you should always have your affairs in order, even and get that insurance and your medical POAs and everything much younger than you need them. And I didn't get mine until after I needed them with my husband's illness.
Hmm.
Uh, but there is hope, and everybody isn't reacting to things the same. This one particular
There are
woman that was
benefits. Yeah.
I saw a woman, she actually died within 2 weeks 'cause that's what she was told, she had 2 weeks to live. They did an autopsy, there wasn't a speck of cancer in her body. So, hopefully, that was before we were doing AI like we were. Hopefully, we can be more clear about, but just because your doctor's even searching for something based on your risks doesn't necessarily mean that give up, because if you give up mentally, we've talked about how strong the human mind is. Um, you still have to
Yeah.
do the basics of self-care. You have to keep one foot in front of the other, and you do your own research because that's what we do, but make sure that any questions are, handled by a professional. Take your questions and say, well, you
Yeah.
know, when I see these commercials, ask your doctor if your heart is healthy enough for that little blue pill or something. Or there's some Crohn's disease and other new drugs coming out, which are always very expensive. And ask your doctor if this is right for you. That offends me. My doctor should take my symptoms, I feel, and use his expertise and tell me if it's right for me. Um,
Yeah.
have you had the experiences like that?
Yes, actually, a little short story. When I was working in pharmaceuticals in research, I went to the doctor and I was having extreme allergy situation, and my body's hypersensitive to medications, so I'm very minimalist of on anything I take. And I told him, I said, look, this new drug came out. It's Flonase, and that's when Flonase came out, and I could just do a nasal, inhalation type thing, so it's not going to be a lot in my bloodstream. He pulls it up. He goes, "How did you know about this?" So in that case, it was a benefit, you know. I think though we need, the audience needs to know there are faster claim processing situations of which you've mentioned. It reduces the paperwork all around. It's interesting they still give you that paper once a year. Here you have to fill this out, and it's like, wait a minute, But it does improve customer service to a certain extent. um, I think that can go either way until their learning curve needs to improve. And then I think we'll have better customer service. There's also better identification of care needs. You know, further benefits, AI can help connect information as long as it's the correct information. It can help with additional benefits. Maybe there's benefit support stuff that you can actually look up, which would be great. AI can provide healthcare professionals with data-driven insight that supports more informed clinical administrative decisions. And if you don't think something's correct, by all means, ask your physician, mention it to them, because everybody's human in here, dealing with this system. And, everybody can make a mistake here and there. So be self-sustainable and remember to ask questions.
And you should always write your questions down before you go see your provider. And I've had patients in my home care experience come back from their doctors feeling like they were cheated because the doctor didn't have time to talk to them. But the nurse practitioner, we turfed me to the nurse practitioner. Be grateful that he had one to talk to you because they usually have the time. And um, so we're going to come back to our final section and wrap this up. If you have any questions as you're watching this on our YouTube channel, leave your questions there. I can, find resources in your area that can help you. We'll be right back for a final break. Thank you.
Author, radio show host, and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness, Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them, rediscover and assess their core values, philosophies, and competencies, find settings that allow them to be the most productive, and track their progress towards accomplishing goals. Did you know that your beliefs create your entire reality, but it's the subconscious beliefs that do most of the creating? Belief shifter and life coach Shiraz can help you identify those limiting beliefs and eliminate them, often in a single session.
Like it was almost instant, like I had relief right away.
Creating better health, relationships, careers, and finances. Let Shiraz help you step out of safety and into awareness.
Definitely something's happening. It's like a flow inside. It feels good.
Whether in person or online, Shiraz provides personal coaching, belief shifting. Visit Shiraz at energeticmagic.com or call 416-529-7429. Energetic Magic. Find your greater happiness. Be well. Be aware. Be magical.
Hi, welcome back to the Holistic Nurse with Peggy and Dr. Gloria Warren. We're discussing and educating about AI and how it can actually help us live healthier lives.
I'll just intervene here and just mention some of the potential AI IT concerns, technology concerns. So algorithm bias, it is there. It could produce unfair outcomes, and yes, it can. If it's trained to be incomplete or biased with biased data. So it only knows what it's fed. So you can add to that database world if you want. There are ways to do it through ChatGPT and Claude and all these other AI programs. So just letting you know, I've corrected several things already in AI in the warehouse. So it's sometimes would be unintentional, who knows, but whatever it is, it can be corrected. And transparency is important because patients and providers, they should always understand how AI assisted decisions are reached, and that means using their own brain as well. So privacy and protecting patients' privacy requires clear policies. So that's one of those questions you would ask them about. And all necessary policies may not be in place. So it's good to ask those questions. Human oversight means humans always review major healthcare decisions. Your medical practitioner, whether it be a nurse practitioner, whether it be a naturopathic physician, whether it be a regular physician, you have to be in charge of yourself, self-sustainability. Please keep that in mind. Most experts agree that major healthcare decisions should include human oversight to ensure accuracy, ethics, and patient-centered care. What protections should patients expect when AI influences healthcare decisions? Well, that's what we're going to talk about right now. So it's up to you there.
Okay, well, as I said before, you always have the right to appeal any denials, and any questions at all, you should, because you don't want the incorrect information, and if you need the service, you want the services. One thing we didn't mention too much, remote monitoring. AI has developed a whole bunch of tools for you to help learn how to monitor yourself and give your doctor information that might have taken 3 or 4 doctor's visits for him to gather. Many people have smartwatches. There are also intelligent rings that, you wake up, it tells you, sorry you didn't sleep so well last night. You thought you had a good night's sleep, but they tell you, and especially with the cardiac patients, the diabetic patients, you have a sensor. You don't have to stick yourself. That's when people weren't very compliant. They didn't like sticking themselves. Now you have a sensor on your arm, put your little thing on it, and you can tell at any minute, even in a crisis, if you're a very brittle person, what the problem is.
Mhm.
You get warning signs. Your body can actually tell you on your smartphone, hey, stop and sit down. Or my watch is always telling me it's time to stand up. I'm in my car a lot driving. They tell me I sit too much. But a lot of the cardiac things, you can do an EKG at home. You don't have to know how to interpret it. But if you're not feeling right, you have a heart history, do that personal EKG and you can email it to your doctor immediately. Your cardiac doctors are often sending you home with monitors that used to be a hospital procedure. Um, if you can't tolerate blood thinners, there's a device to help catch clots so you live without blood thinners. Um, is there anything here? We only have a couple minutes here, Gloria. Can you think of something else here that we should,
Well,
it's really, I think
I
it's,
do want to mention,
yeah, go
I
ahead.
do want to mention all of your diagnostic machines, whether it be a lab machine or what you put on your arm or whatever. There is an error margin there that is tolerated by the FDA. So you need to consider that. Let's say you're a diabetic and all of a sudden, let's say you're running between 120 and 160. All of a sudden you have a 280 glucose and your meter's going off, your phone's beeping like crazy. You know, it does pay to have a separate one. You test your blood at home to
The old
see
fashioned.
on what it is, right? Because all devices do have a margin for error, and it doesn't happen often, but it can happen. So you need to have a separate device to double check periodically with certain things. So, and if something comes up wrong on the device, let's say we were talking at home sleep um, scenario where they're testing your sleep for sleep apnea or whatever, there can be errors even in that. And if your physician says, no, that's the way it is, I suggest you may want to see a different physician because sometimes that they're not as accurate as they would like to see. And they'll get better over time though. But at this point in time, as of today, I'm just saying, you know, be
Well, and
your
it's
own
always,
advocate.
you need to follow your gut. If when I was in the hospital, make this real quick, I called the doctor, the resident. I said, I need you to come see my patient. He's going to code. Well, what's his vital
Mhm.
signs? His vital signs are perfect, doctor. I know he's going to code. I've been a nurse long enough to know. Doctor was very grumpy about coming. He got here just in time for us to bring the crash cart out and save the patient's life. But, the science numbers aren't always what's really going on. The healthcare providers, we do listen to the patients. I might feel it like sometimes we don't, but you are the best person to tell your doctor what's going on, not the monitors. And, you know, so everybody, please stay responsible, stay healthy, stay on top. Don't assume that healthcare is perfect. It's far from perfect, uh, but it's a lot better. We have a lot more opportunities and, capabilities than we did in the past. Welcome to take any questions on the website after you watch this. And thank you for joining us. Please make sure you like and share this for people that also consume healthcare and need this information. Gloria, thanks for joining me today. As usual, it's been a pleasure. And we will see you next week. Have a great week, everybody, and stay healthy.
This has been The Holistic Nurse with host Peggy Smith. Tune in each week where you're encouraged to send in questions and receive private responses and suggestions if appropriate. Here's Saturdays, 1 p.m. Eastern.